Hi everyone, welcome back to my YouTube channel. Today we are going to talk about temporal bone. So let's start our topic with introduction. Temporal bone is one of the most complex bone in human skull, playing a crucial role in protecting vital structures such as brain, auditory system, and major blood vessels. It is located on the sides of skull and contributes to the formation of cranial base. Now let's talk about parts of temporal bone. Temporal bone is divided into four distinct regions, and these regions are squamous part, petrous part, tympanic part, mastoid part. Now let's talk about these parts one by one. First is squamous part of temporal bone. This is the largest and most superficial section, as you can see here in the diagram. It forms the lateral aspect of skull and it provides attachment for temporalis muscle, which is involved in mastication. The next part is petrous part, as you can see here in diagram. It is the strongest portion of the temporal bone. It houses the inner ear structures including the cochlea and vestibular system. It contains the internal acoustic meatus which transmits the vestibulocochlear nerve, that is cranial nerve number 8. Next part is tympanic part that surrounds the external acoustic meatus that form part of the ear canal. As you can see here in the diagram, it plays a crucial role in sound production. Next part is mastoid part. As you can see here in the diagram, it is located posterior to the ear. It contains mastoid ear cells which help regulate ear pressure. It serves an attachment site for muscles of head and neck. Each of these sections contributes uniquely to the bone's functional and anatomical significance. Now let's talk about functions of temporal bone. Temporal bone serves multiple important roles that include protection, as it shields structures that like brain, inner ear, and major blood vessels that are delicate structures. Second function is hearing and balance, as it houses the auditory system including the cochlea and semicircular canal. Next function is muscle attachments, as they provide anchor point for muscle involved in mastication, head movement, and facial expression. Next function is pathway for neurovascular structure, as it contains foramina that facilitate passage of cranial nerves and arteries. Now let's talk about important landmarks of temporal bone. Several key landmarks and openings are found in the temporal bone, and they include external acoustic meatus, that is the canal leading to the eardrum. Internal acoustic meatus that transmit cranial nerve number 7, that is facial nerve, and cranial nerve number 8, that is vestibulocochlear nerve. It has stylomastoid foramen, that is passage for facial nerve. It has carotid canal that allow passage or entry of internal carotid artery, and it has jugular foramen, that is passage for important veins and nerve. And these anatomical features facilitate communication between various systems of head and neck. Now let's talk about role of temporal bone in hearing and balance. Temporal bone play a critical role in auditory and vestibular functions, as it works in hearing, as the cochlea located within the petrous part converts sound vibration into the neural signals transmitted to the brain. And talking about balance, the vestibular system including semicircular canal detects changes in head position and aid in equilibrium. Damage to this structure can result in hearing loss or balance disorders. Now let's talk about clinical relevance of temporal bone. Several clinical conditions or medical conditions associated with temporal bone. These are fractures, as temporal bone fracture can result from trauma such as accidents or falls, and symptoms including hearing loss, dizziness, facial nerve paralysis, and cerebrospinal fluid leakage can happen. Second clinical relevance is otitis media, that is infection of middle ear potentially affecting the temporal bone, and it may lead to mastoiditis, that is infection if spread into the mastoid ear cells. Talking further about the clinical relevance of temporal bone, there may be cholesteatoma, that is destructive growth within the middle ear that erodes the temporal bone. It causes hearing impairment and it can affect cranial nerve function. Next clinical relevance is tumor and abnormal growth, as tumors such as glomus tumors or acoustic neuromas can develop within or near the temporal bone, causing hearing deficits and neurological symptoms. Next clinical relevance is congenital abnormalities, as some individuals are born with developmental anomalies affecting the structures and function of temporal bone. Proper diagnosis and treatment are essential in managing these conditions. Now let's talk about imaging and diagnosis in case of temporal bone. Clinical assessment of temporal bone disorders often involve imaging techniques such as X-rays that are used to detect fractures, CT scan that provide detailed bone imaging for trauma or infection, and MRI scan that is used to evaluate soft tissue structures such as nerves and tumors. These imaging modalities assist physicians in identifying and treating abnormalities effectively. Now let's talk about surgical interventions for the temporal bone. Certain conditions affecting the temporal bone require surgical management that may include mastoidectomy, that is removal of infected mastoid cells, tympanoplasty, that is reconstruction of tympanic membrane and middle ear structure, cochlear implant surgeries, that is implantation of electronic device to assist individuals with severe hearing loss, and these procedures aim to restore function and prevent complication. Now let's talk about conclusion of our whole this lecture video. Temporal bone is one of the most structurally complex and functionally significant bones in the human body. It supports auditory and balance function. It houses critical neurovascular structure and play a role in various pathological conditions. Understanding its anatomy, physiology, and clinical implication is essential for medical professionals and researchers working in neuroanatomy, otology, and neurosurgery. And this was all about temporal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.